Good morning, everyone. Hello, am I live? Can you see me? Can you hear me? Priyanshi, Osama, Sushil, Ashish, anyone can reply? Can you see me? Give me a minute to confirm. Let me start on my gadget also, the YouTube. Yes, I guess it's working. Yes, it's working. So I welcome you all for today's session. A very good morning to all of you. So every morning I feel so energetic that I must teach you the complete syllabus today only, right? So you must have the same enthusiasm every morning, a new day, a new hope, a new beginning with a new day, right? New energy. So you must think that today you will study a lot. You will give a productive day today. At the end of the day, you will be satisfied by your doings, right? So I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I am going to teach you a very important topic from pharmacology on huge demand of students, right? So students find this topic very difficult. The drugs acting on Renin-Angiotensin system, that is RAAS. Two types of drugs will be dealt today, that is ACE inhibitors, the most important topic for today, and ARBs, that is angiotensin receptor blockers. So ACE inhibitors and ARBs will be the topic today, and this topic is going to be super duper important for second Prof University exam as well as for MCQs. You can't imagine how important this topic. It is a must attend session. Anyways, let me move further, right? So in CVS, in pharmacology, we have to study 5 chapters. Out of the 5 today, we are taking the first one. So the drugs acting on RAS, I will teach you today, and gradually I'm going to launch all these topics one by one, because all 5 topics are difficult. I know students found it difficult. So the drugs acting on heart failure, the drugs for the antiarrhythmic drugs, the drugs for the angina, and drugs for hypertension. So all these drugs I am going to take one by one. Are you people there? Can we go ahead? So I am taking the first chapter, the drugs acting on RAS. Before understanding the drugs acting on RAS, renin-angiotensin system, you should understand what is RAS. Students even don't have concept कि मैम RAS होता क्या है. The drugs acting on RAS तो ठीक है, लेकिन RAS क्या होता है? What is renin-angiotensin system? Is this system present in me? Is this system present in you? Yes. Every human being have the system inside them, inbuilt system. So what is this system? See, this is the system. I have drawn this master diagram. I am going to teach you everything today in this master diagram only. Understand this diagram. In our blood, please everyone here on the screen, in our blood, we all have a protein in our blood. The name of the protein is Angiotensinogen. It is present in you, me, every normal human being on this earth. It is present in blood. So who is making this protein? This protein is formed by liver, right? Liver secrete this protein in the blood, but the important point, it is inactive. It is inactive. It is present in me, you, everyone, but it is inactive. Right. So angiotensinogen is a protein. It is secreted by the liver. It is present in blood of all normal human beings, but it is inactive. Right. Now, whenever we have fall in BP, just suppose if any patient, any person have severe vomiting, severe diarrhea, or road traffic accident, loss of blood, surgery, or sudden wake up from the supine to prone position, in any of these conditions, of these conditions there is sudden drop of BP, so whenever we have vomiting, we have diarrhea, when we are lying down in the night, and in the morning we suddenly get up, so all the blood will be flushed in the legs, right? So we have fall in BP. So at that point, whenever there is a fall in BP, the kidney have a sense to judge it. Inside the kidney we have a nephron. Each kidney have 1 million of nephron. Humans have a pair of kidney, right? So each kidney have 1 million of nephron. In the nephron we have glomerulus. In the glomerulus, we have afferent arteriole and efferent arteriole. In the afferent arteriole, there is a special cell known as juxtaglomerular cells. Those cells secrete an enzyme in the blood known as renin. Renin is not a protein. Renin is an enzyme secreted by the JJ cells of the kidney. The juxtaglomerular cells of the kidney, when it is secreted, currently it is not present in me because my blood pressure is normal. If you measure my blood pressure, it is approx 120 by 80. But due to any reason, if there is fall in BP in me, in you, in any of the human being, right, the kidney, the JJ cells of the kidney will sense it that blood pressure is low, and they will secrete the renin in the blood. This renin will go in the blood and act on the angiotensinogen protein, which is secreted by the liver, and convert the angiotensinogen into angiotensin 1. Again, angiotensin 1 is lightly active, but mostly it is also inactive. Give me a thumbs up, you are getting it. So angiotensin 1 is formed. So initially angiotensinogen is there. and it get converted to angiotensin 1. These both are proteins, right? Both are inactive. So the conversion is done by an enzyme. The name of the enzyme is renin. It is secreted by kidney, the JJ apparatus of the kidney, right? Now this angiotensin 1 is present in the blood. Blood is going in all organs. So this angiotensin 1 is also going in all organs of the body. So it is going in lungs also, right? Lungs also. When the lungs, it is going in the lungs. When the lungs are exposed to angiotensin 1, right? Angiotensin 1. So lungs secrete another enzyme in the blood. It is also an enzyme. It is known as angiotensin converting enzyme. What is it? Is known as ACE. What is the full form of ACE? Say it. What is the full form of ACE? Angiotensin converting enzyme. It converts angiotensin 1 to angiotensin 2. That's why known as angiotensin converting enzyme. This angiotensin 2 is the most active form of this family. This one was inactive. This one is lightly active, but this is highly active, angiotensin 2. So finally, with the help of two enzymes, angiotensin 2 is formed. And gradually, angiotensin 2 converted into 3 and 4, but 3 and 4 are again non-active. So everything is non-active. Only active thing of this family is angiotensin 2. I guess everyone got it. Give me a thumbs up. Give me a thumbs up if you got it. I'm explaining you once again this diagram. If you understand this diagram, understanding the chapter will be fun for you. Believe me, it will be fun for you. So can you see this diagram? I guess everyone can see, right? So I have told you, in our blood, in all human being blood, you, me, everyone, if you test your blood, we all have angiotensinogen in our blood. It is inactive protein. It is a protein which is inactive. It is secreted by liver in the blood. It is present in all of us. Whenever we have fall in blood pressure due to any reason, so kidney will get stimulated. Inside the kidney we have nephron. In the nephron we have glomerulus. In the glomerulus we have JJ cells, juxtaglomerular cells, that will get stimulus because of fall in BP, and they will secrete an enzyme in the blood. The name of the enzyme is renin. Renin convert angiotensinogen to another protein which is known as angiotensin 1. But again, it is also inactive. But this conversion takes place. Or lightly active. You can't say completely inactive. A little bit activity is there, but not much. Right? So angiotensinogen protein get converted to another protein, angiotensin 1. But the conversion requires an enzyme. The enzyme will come in blood only when fall in BP. Otherwise, it will not come in blood. You got my point? Give me a thumbs up on this point. Right? Right. Now this angiotensin 1 is present in blood. It is going in all organs via blood. When it will go in lungs. So when the lungs are exposed to angiotensin 1, it will secrete another enzyme in the blood. The name of the enzyme is ACE. What is the full form of ACE? Angiotensin converting enzyme. It converts angiotensin 1 to angiotensin 2, which is the active protein. So finally, angiotensin 2 is formed, right? And it will show the action now. Gradually, after action, it will convert into 3 and 4 and this excreted from the body. But the most active form is angiotensin 2. So finally, we are having 3 proteins and 2 enzymes. So the 3 proteins are angiotensinogen, which get converted to angiotensin 1, which get converted to angiotensin 2, right? And the 2 enzymes are renin, secreted by kidney, and ACE, secreted by the lungs. So this family is known as RAAS family. What is the name of this family? There are 3 proteins and 2 enzymes members of this family. This family is known as RAAS family. Can you say the full form of RAAS? Renin-Angiotensin System family. So in this family, we are having few proteins, we are having few enzymes. This system will be activated only when there is fall in BP, otherwise it is not activated. So in any human being, if there is fall in BP due to any reason, the reason can be vomiting, the reason can be diarrhea, the reason can be bleeding, the bleeding can be due to accident, due to surgery, due to anything, it can be any reason. Fall in BP is there. So this system is given as a backup by the God in all of us, inbuilt system. So you will say, ma'am, how they are again increasing the BP. This angiotensin 2, which is the active form, it will act on 6 organs. I will show you the next diagram. 6 organs in human body, and there are receptors. It will act on the 6 organs and again cause rise in BP. So rise in BP means maintain the BP. If the BP is 120 by 80 and by falling it is becoming 90 by 70, just suppose, right? So this system will come in role, and this angiotensin 2 by acting on the 6 organ, I will tell you what 6 organs. Again, it will increase the BP from 90 by 70 to 120 by 80. So this is how we maintain our BP, and we don't die when our BP falls. You got my point? So we are not going in shock unless until this system is inactivated. We all have the system. Thankfully, thanks to God, this system is present in all of us. In all human beings on this earth, this system is inbuilt. It is given. We don't think about it. So whenever I get up in the morning in supine position, I get up in the morning, Suddenly I am just in the straight, like standing position, so all the blood goes in the lag, so we have fall in BP due to the, this is known as postural hypotension. So at that time this system comes in the role, right, and again increases the BP and maintain the BP. Every time it comes in the role whenever there is fall in BP. Everyone give me a thumbs up, everyone. So Gaurav, Priyanshi, Osama, Padmavati, Lofer, everyone, right, Vardhan, right, everyone give me a thumbs up. You got it? So this is the basic. You got it, right? So inside the kidney, you can see this is the glomerulus. In the glomerulus, this is the nephron. In one kidney, 1 million nephrons are there. This is the glomerulus. Inside the glomerulus, you can see this is afferent arteriole forming tuft of capillary, and this is efferent arteriole. So in the afferent arteriole, we are having this apparatus. This is known as JJ apparatus. JJ cells are present which secrete renin in the blood. So this renin is coming from this apparatus. This apparatus is known as juxtaglomerular apparatus. It is present inside the kidney, but you should have an imagination that inside the kidney where it is. Inside the kidney, it is present in the nephron. In the nephron, which portion? Not in PCT, not in loop of Henle, not in DCT, not in collecting duct. It is present in glomerulus. In the glomerulus, where they are present? In afferent arteriole or efferent arteriole? In afferent arteriole, this apparatus is present and it is secreting this renin in the blood. And after that, the complete thing is happening. So the same story is written in front of you. Just look at. So whenever we have fall in BP, the renal perfusion falls. So the JJ cells sense it that there is a fall in BP. They get activated and they secrete renin. They secrete renin in the blood. Renin convert angiotensinogen into angiotensin 1. This angiotensin 1 is going to the lung. The lung is secreting another enzyme ACE, and which convert into angiotensin 2. Better than this to draw this. I guess this is easy. This is the master diagram, right? Okay. Now this angiotensin 2, after coming in blood, it will go on 6 organs. On 6 organs, it is having the receptors, right? 81 and 82. Two types of receptors. Mainly 90% receptors are 81. 81. Now don't get confused. What I am saying, listen. Angiotensin 2 have receptors on 6 organs. The name of the receptors is 81. Angiotensin 2 के receptor का नाम है 81. 1 और 2 में confuse मत होना. See the 6 organs, they are in front of you. See the same story again. Everyone, and give me a thumbs up, right? So angiotensinogen secreted by liver get converted to angiotensin 1 by renin, and angiotensin 1 get converted to angiotensin 2. So this is the active form. It is acting on 6 organs. Why it is coming in role? Because of fall in BP. So this angiotensin 2, by acting on the 6 organs, you can see it will again cause rise in BP by acting on the 6 organs, right? So the first organ is heart. See here, I have drawn heart. From the heart, blood vessels are coming. So lung, the second organ is the blood vessel. So first organ is heart. From the heart, blood vessels are coming. Lung, the 2 organs. The third organ is kidney itself, right? Kidney. Just above the kidney, we have a gland, suprarenal gland, that is adrenal gland. So kidney and adrenal learn as a pair. So learn the first pair, heart and blood vessel. Learn the second pair, kidney and adrenal. Learn the third pair, brain. Number 1, brain. That is central nervous system. From the brain, nerves are coming. That is peripheral nervous system. So there are total 6 organs. I will tell you how. By acting on these 6 organs, the angiotensin 2 is again causing rise in BP. On each and every organ, the ultimate function is rise in BP. Give me a thumbs up. Now, you tell me on all these 6 organs, which receptors are present? For angiotensin 2, 81 receptors. So see, here I am drawing 81. Here also I am drawing 81. So here also, here also, here also, here also. On all 6 organs, we have 81 receptor. Angiotensin 2 act on 81 receptor on these 6 organs and causes rise in BP. Yes, Priyanshi, Osama, absolutely right. Everyone give me a thumbs up. Come on. So same story is written in front of you. This diagram is from KD Tripathi book. So same, I try to simplify this diagram like this, right? So same information is given. You can read if you wish. So angiotensinogen get converted to angiotensin 1 with the help of renin, right? Then angiotensin 1 get converted to angiotensin 2 with the help of another enzyme known as ACE, angiotensin converting enzyme. And finally, it is acting on its receptors, right? And after acting on its receptor, after acting on the 6th organ, this angiotensin 2 convert into angiotensin 3 and 4, which are in active form and excreted out of the body after acting on this 6th organ. But I am not interested in angiotensin 3 and 4. They are the excretory products. Ultimately, it will excrete from the body. But I am interested in angiotensin 2. right? Because it is acting on the 6 organs, right? Okay, one more point I would like to highlight here. Okay, let me show you. Let me erase it. Okay, something went wrong, I guess. Give me 1 minute. Okay, yes. I guess you can see this diagram. Yes. Okay, listen. What I'm going to say. What are the two enzymes? Can you highlight the two enzymes? What are the two enzymes? I'm asking only about enzymes, not about others. What are the two enzymes? Can't change the color of the pen. Okay. The first enzyme is the renin, which is secreted by the kidney. What is the second enzyme? ACE. Okay. Yes, ACE. Yes, Osama. Yes, Annalipsa. ACE. I'm interested in ACE. I want to tell you one more point about the ACE. What's the normal function of ACE? Renin convert angiotensinogen to angiotensin 1 and ACE convert angiotensin 1 to angiotensin 2, right? So from where the ACE is coming? ACE is coming from which organ? The ACE enzyme is coming from lungs, I have told you. But it is coming from the lungs only when there is fall in BP. Otherwise, it is not coming out of the lung. So when it is present only inside the lung, currently I don't have fall in BP, my blood pressure is normal. So inside my lung, this ACE is present. So what is the function of ACE normally inside the lung? When fall in BP, it is coming in the blood. But when there is no fall in BP, it is remaining in the lung only. So when it remains in the lung only, it converts. In our lung, bradykinin and substance P are formed constantly. In me, you, everyone it is formed as a side products of multiple metabolic pathways. So bradykinin and substance P causes cough in us. They causes cough, they causes swelling, they causes angioedema, they causes itching in us. They are not good substances. So God has given this enzyme in our lungs. ACE converts bradykinin and substance P to inactive products. That's why we don't have cough normally. We don't have swelling. We don't have angioedema. We don't have itching. Because in us, the bradykinin is formed. In me also, in my lung, in your lung, in everyone, we have formation of bradykinin. But it automatically get converted to inactive products with the help of ACE enzyme. Give me a thumbs up. Give me a thumbs up. You got it? So you have to understand this point also. If you have learned this, the same thing is written here. So ACE ka two functions hai. When fall in BP, you can see. When fall in BP, this ACE convert angiotensin 1 to 2. But without fall in BP, constantly it is doing this function. It is converting bradykinin and substance P to inactive products. Normally it is doing this function. So I guess you can understand this now. This is the masterpiece. The masterpiece. I guess everyone can understand. Let me mark the two enzymes with red color. Right, renin and ACE. Let me mark the proteins with blue color. So these are the three proteins, right? So angiotensinogen get converted to angiotensin 1, 1 get converted to 2, right? The two enzymes required are in front of you. ACE have a double role. You can see the ACE, the double role of the ACE. On one side, it is used for converting angiotensin 1 to 2. On other side, it is used for converting bradykinin into inactive products. Now you can imagine I'm going to teach you the drugs which inhibit ACE. So the drugs which inhibit ACE, I require only this function. I do not want angiotensin 2 to form in that particular class, right? But this function will also be inhibited because ACE inhibitors I am giving. So patient will have cough as a side effect of ACE inhibitors. Patient have swelling, patient have angioedema, patient have itching. So these are the side effects of ACE inhibitors. You got it with the mechanism. You got my point? So this is the reason why ACE inhibitors presents with cough, itching, angioedema and swelling. Give me a minute. Right, can you proceed ahead? Okay, if you got all these things, you got about the receptors also. There are two types of receptors, 81, 82, but most of the functions are because of 81. 82 is not really very important. So you can see the 6 organs, you can see the receptors on them. Now, let me tell you one more thing, how on 6 organs it is acting and causing rise in BP. Then I will start the chapter. How it is acting on the 6 organs. So you can see the 6 organs in front of you. This is heart, this is blood vessel, this is kidney, this is adrenal, this is CNS, this is PNS. On all these organs, I will discuss one by one. Let me start with the heart. What is the action? Let me start with the blood vessel. What is the action on the blood vessel? On the blood vessel, it causes vasoconstriction. On the blood vessel, because of angiotensin 2, I am telling you the actions of angiotensin 2. Angiotensin 2 acts on its receptors, 81 receptors on the blood vessel and causes vasoconstriction. Now you yourself tell, because of vasoconstriction, BP will rise or fall? I'm asking you, Osama, Ajay, Vardhan, Padmavati, Mukul. Because of vasoconstriction, BP rise or BP fall? Common sense. Because of vasoconstriction, the BP rise. BP don't fall. BP fall because of vasodilatation. And I am saying angiotensin 2 is causing vasoconstriction on the blood vessel. Because of the vasoconstriction, it is rising the BP. Of course, on all these 6 organs, the ultimate function is rise in BP. सब पे काम एक ही है, rise in BP करेगा, but mechanism अलग अलग है. So angiotensin 2 blood में आया ही क्यों? Why angiotensin 2 is appearing in the blood? Because of fall in BP. So by acting on these 6 organs, it will cause rise in BP. So basically on blood vessels, it is causing vasoconstriction and causing rise in BP. Learn that. Learn that. Coming on the second organ, heart. What it is doing on the heart? In the heart, it is increasing the force of contraction. It is increasing the heart rate. Right? Force of contraction is also increased. Heart rate is also increased. Cardiac work is also increased. Right? So ultimately, rise in BP is there. Ultimately, rise in BP is there. But for causing, increasing the force of contraction, it is doing hypertrophy and hyperplasia of the myocardium. Basically, hypertrophy of the myocardium. Left ventricular hypertrophy. The wall of the left ventricle gets thickened to contract more. It is not a good thing in the long term. Temporarily, it is okay. But long run, it is not good thing. The heart wall gets thickened permanently. Right? But yeah, for causing rise in BP, it's okay. So ultimately, on heart also, it is causing rise in BP. What it is doing on the adrenal cortex. Okay, see what it is doing on the kidney. The third organ is the kidney. In the kidney, it causes increased sodium water retention. Increased sodium water. What's the function of normal kidney? What's the function of normal kidney? What does normal kidney do? Normal kidney forms urine. Forms urine. The formation of the urine. Right? How does normal kidney forms urine? The normal kidney, what does it do? It causes absorption of sodium. It causes absorption of sodium and water. Sodium and water get absorbed, right? And it causes the urine formation which is excreted, right? So what it is doing, the angiotensinogen 2 increases sodium water reabsorption. So more and more sodium water is reabsorbed from the blood. So blood will get concentrated and it increases the blood pressure, right? Because of increased sodium water reabsorption, right? So that is the mechanism of action in the kidney. What is the mechanism of action at the aldosterone? Very important. Aldosterone. In the aldosterone, it stimulates the aldosterone. It stimulates the adrenal cortex to increase the synthesis and release of the aldosterone. Aldosterone will come in the blood and causes rise in BP. Again, you got my point? So that is the fourth organ. The fifth organ is the brain, CNS. In the CNS, we all have a thirst center. Right? Thirst center. जिससे हमें प्यास लगती है. Whenever we are thirsty, we drink water, we drink fluids. Right? We drink fluids. Right? So thirst center will get stimulated. So person will drink more and more water. More and more water will be drink and more volume of the blood will be there. It causes rise in blood pressure because of volume expansion. Right? In the brain. Right? And in the peripheral nervous system, we have two types of PNS. The sympathetic and parasympathetic. It causes stimulation of sympathetic, not parasympathetic. It causes stimulation of sympathetic and sympathetic causes rise in blood pressure. We know that. So by acting on the sixth organ, can you enumerate fast? Can you enumerate the action on the 6 organs one by one? How it is causing rise in BP? The 6 organs are in front of you. I am talking about angiotensinogen 2. Angiotensinogen 2 acting on the 6 organs. The 6 organs are in front of you. Right? The 6 organs have a receptor. The name of the receptor is 81. Angiotensin 2 acts on 81 on all these 6 organs and causes rise in BP by various mechanisms. Let's start with blood vessels. In the blood vessels, it causes vasoconstriction, which leads to increase in blood pressure. Right? Give me a thumbs up. In the heart, it increases the force of contraction. It increases the heart rate. It causes hypertrophy of the left ventricle. So because of which the blood pressure is raised. Give me a thumbs up. In the kidney, it causes sodium and water retention. Not excretion. I'm sorry, it is sodium water retention. It retains more and more sodium water. More and more sodium water, more plasma volume. It causes rise in blood pressure. What about the adrenal cortex gland? From the adrenal cortex gland, it causes secretion of aldosterone. Aldosterone also causes sodium water retention and causes rise in blood pressure. Give me a thumbs up. Give me a thumbs up. In the brain, it stimulates the thirst center. So person feel more thirsty, drink more water, more volume of plasma, more blood pressure. You got my point? And in the peripheral nervous system, there are two types of PNS, sympathetic and parasympathetic. So angiotensin 2 stimulates the sympathetic one, not the parasympathetic one, which causes rise in blood pressure. Everyone give me a thumbs up if you got the six mechanisms and you got the summary that acting on all these 6 organs, the ultimate purpose is to cause rise in blood pressure. Because angiotensin 2, the purpose of angiotensin 2 to come in blood is fall in blood pressure. Whenever we have fall in blood pressure, this is formed and acting on the sixth organ. Again, it is causing rise in blood pressure. Mind my words. By rise in blood pressure, I mean normal blood pressure. It is not hypertension. Listen, it is not hypertension. Person have fall in blood pressure. So blood pressure of the person is less than 120 by 80. It is less, then it is coming in role. So by rising, it is causing only 120 by 80, not more than that. So person will have, at the end, the person will have a normal blood pressure. By acting on the sixth organ, it will degrade into angiotensin 3 and 4 and excreted out of the body. Right, it will not act permanently. Now whenever again the person have fall in blood pressure, the again same story is repeated. So every time whenever we have fall in blood pressure, the story is repeated. And after acting on the sixth organ, maintaining the blood pressure to 120 by 80, it is excreted out of the body. That's why our blood pressure is always maintained. Plus minus 10-20 chalta hai, but always it is maintained at 120 by 80. Because God has given the system inside all of us, the inbuilt system. We don't think about it, but it is working inside us. Give me a thumbs up. You got it? Yes, yes. So this is the thing. Now out of the sixth organ, the most important one organ, if you say, it is adrenal cortex, the aldosterone. This is the most important organ which contribute in rising the blood pressure. Everyone is contributing, but a little bit. Most important contribution is by aldosterone secretion from the adrenal cortex, which is causing sodium water retention. So if you want me to highlight one action out of the six, I will go with adrenal cortex. Now if you got the basics, let's start the chapter then. Let's start the chapter. Before start, now अभी तक तो सिर्फ भूमिका बन रही है, chapter तो start ही नहीं हुआ है, ठीक है? Chapter start करेंगे, we will start it. But before that, you must understand what is hypertension. Hypertension is rise in blood pressure. Everyone knows. The normal systolic blood pressure is 120, diastolic is 180. If any of the blood pressure is rising, it is known as hypertension. It is sustained increase in the blood pressure, systolic as well as diastolic. So various types of hypertension is there. The normal blood pressure is less than 120 and less than 80, it is normal. And when it is increasing to such a range, it is pre-hypertension, stage 1 hypertension, stage 2 hypertension. You should know this classification in medicine. So if the patient is coming to you, what is the blood pressure of the patient? The systolic between 120 to 140 and diastolic between 80 to 90, the patient is having pre-hypertension. Start the treatment, right? Ask for the lifestyle modification. Ask to take less salt, more physical activity, more exercise. Then the systolic is 140 to 160 and diastolic is 90 to 100. It is stage 1 hypertension. If systolic is more than 160 to 200 and diastolic is 100 to 120, it's stage 2. If it is more than 200 and more than 120, systolic and diastolic, it is known as malignant hypertension. So this is the classification you must know, right? Now you must understand what is the cause of hypertension before starting the chapter. How many of your parents or your grandparents are hypertensive? How many of you? My parents, my both mother, father, both are hypertensive. My grandparents were also hypertensive. I mean to say, with age, most of the person develops hypertension automatically. After 60 years of age, it's very common to have hypertension. I want to ask the reason why with aging person develops hypertension. My parents are hypertensive. My grandparents were also hypertensive. Many of my neighbors who are more than 50-60 of years, they are hypertensive. I see many patients having hypertension. Is such a comorbidity in our society that every third person you find that is hypertensive. Give me a thumbs up. I want to ask the reason why. Have you ever thought why the BP increases? Why? Okay, 80% of the hypertension is due to overactivity of the RAAS. Overactivity of RAAS family. You got my point? What is RAAS family? I told you what is RAAS family. RAAS family, okay, give me a minute. Let me explain you the overactivity of RAAS. This is overactivity of RAAS. I am assuming this family to come in role whenever the blood pressure falls. Listen everyone, please understand. When blood pressure falls, then only renin should come in the role and start the sequence. Right? When fall in blood pressure is there. That is blood pressure is less than 120 and 80. But even on normal blood pressure, if it is activating, imagine some person is having 120 by 80 blood pressure. It's normal. But even at normal blood pressure, it becomes hyperactive and renin is coming in the blood. So if once the renin is coming in the blood, the complete system will get activated and all the 6 organs, angiotensin II will act and it will cause rise in blood pressure. But blood pressure was already normal. Blood pressure was already 120 by 80. Unnecessary the system is coming in role. So उसको फर्क नहीं पड़ता. अल्टीमेटली जब ये सिस्टम रोल में आएगा तो ये ब्लड प्रेशर को बढ़ाएगा. अगर ब्लड प्रेशर पहले से कम है तो बढ़ा के नॉर्मल करेगा. पहले से नॉर्मल है तो पर्सन हाइपरटेंसिव हो जाएगा. समझ में आया क्या? यू गॉट माय पॉइंट. इफ द पर्सन इज नॉर्मल इनिशियली ओनली and this system is coming in role because of the overactivity. Then ultimately it will increase the blood pressure, so person will be hypertensive. This is the reason for hypertension in 80% of the patient in old age. Give me a thumbs up. It is known as overactivity of RAAS. So in our parents, in our grandparents, actually with age, when the age is more than 50-60 years, maybe in our old age we also become hypertensive, right? Most of the person become hypertensive in old age. Why? Because automatically this system become overactive. Even on normal blood pressure, the JJ apparatus is secreting renin in the blood. Once the renin is in the blood, the complete sequence will go on. You cannot stop it. Give me a thumbs up if you got it. Everyone give me a thumbs up. So whenever any patient with hypertension coming to your clinic, doctor, I'm having headache, I'm feeling vertigo, see what is happening. You are measuring the blood pressure. Why the person is having constant headache? Why? So you are measuring. The age of the person is 60 years, 50 years, something, right? And you found the BP is 140/90, something like that. You are saying that you are hypertensive. That's why you are having headache and other symptoms. Right, you are having more heating, more sweating, and you are hypertensive. So person will say, okay doctor, give me the treatment. Give me the treatment. What is the treatment? You should know what is the cause of hypertension. The cause of hypertension is overactivity of RAAS. Now person have increased blood pressure because of overactivity of the system in his blood. You want to inhibit the system. That's why the name of today's topic is inhibition of RAAS. I want to inhibit this family. At what level I can inhibit? Come on. At what level I can inhibit? You will say, ma'am, inhibit the renin. You should give a renin inhibitor. न रहेगा बांस न बजेगी बांसुरी. Renin को inhibit कर दो आप. Renin inhibit हो जाएगा तो angiotensinogen will not get converted into angiotensin 1. 1 is not formed, so 2 is not formed. 2 is not formed, so on all these organs nothing is acting. So no rise in blood pressure, fall in blood pressure, and blood pressure will become normal. The first is renin inhibitors. The second you can give ACE inhibitors. आप ACE inhibitors दे दो. The second you can give ACE inhibitors, right? The second level. Don't give renin inhibitors, give ACE inhibitors. If you are giving ACE, angiotensinogen will get converted to angiotensin 1, but 1 is inactive. 1 will not convert into 2. Ultimately, we mean that 2 shouldn't form, right? Or 2 shouldn't act on the 6 organs. So blood pressure will not rise, it will fall. Number two, right? Number 3, don't give renin inhibitors, don't give ACE inhibitors. Then what to give? Where is this angiotensin 2 is acting? What is the name of the receptor? I told you, on all the 6 organs there is a receptor. The name of the receptor is 81. Say 81. The name of the receptor is 81. On all these 6 organs we have a receptor. The name of the receptor is angiotensin 1 receptor. So this angiotensin 2 after formation is going and acting on its receptor to show its action. What if you block this receptor? You block this receptor with a drug, so that angiotensin 2 is formed. You are not hindering its formation. Let it be formed. But if it is formed in the blood, it cannot act on its receptor, then how it can cause rise in blood pressure? So the third category of the drug, the last category is ARB, angiotensin receptor blockers. So you can block the family at 3 levels: renin inhibitor, ACE inhibitor, angiotensin receptor blocker, ARB. You have to study 3 drugs today. Give me a thumbs up, everyone. So at what levels you can block? You got it? Say yes if you got it. Everyone say yes if you got it. Right? So let's start the chapter. Let's start. Thumbs up. I'm asking for the thumbs up. You got it? So I'm going to teach you 3 drugs today. What 3 drugs? The first is renin inhibitors I must teach. Right? The second, ACE inhibitors I must teach. And third is ARB. ARB is angiotensin receptor blocker. You got at what point we are actually inhibiting the family. Ultimately, we want to inhibit the family because RAAS is overactivated. We don't want the overactivity. We want normal activity. So we are inhibiting this family. Give me a thumbs up. So this is how we treat hypertension in patients. So all these 3 drugs are anti-hypertensive drugs which you prescribe in your patient with hypertension. They decrease in blood pressure. So give it in a person who is having more blood pressure. Right? Yes. So before starting the chapter, let me teach you let me ask you 2-3 questions. First question is in front of you. Let me see who is first and who is correct. Read the question. Angiotensin 2 causes all of the following except. I am asking the except. What does it do not cause? Okay. Stimulates the release of ADH. Number 1. Increase thirst. Causes vasodilation in the blood vessels or stimulates aldosterone secretion from the adrenal cortex. So yes, most of you are right. Yes. So Priyanshi, I guess you are the first and all others are also right. The correct answer is C. It's not causing vasodilatation. It causes vasoconstriction. About ADH in kidney, I told you, it causes sodium water retention because of ADH secretion. So because of ADH secretion, it causes that. So correct answer is C, and you all are right. Very good. The second question is in front of you. I guess the easiest question. Renin is secreted from which cell? Tell me the source of renin. Renin is an enzyme. It comes in blood from which thing? Is it coming from JJ apparatus, PCT, DCT, or collecting duct? We all know it comes from the kidney, but which portion of the kidney? Which portion of the nephron? I guess everyone is right. Again, the easiest question. The correct answer is A. Yes, you all are right. Very good. The correct answer is A. The next question is in front of you. Okay, leave it. We will do this later on. Let me come on the drugs. So chapter अब start हो रहा है. अभी तक तो उसकी भूमिका बन रही थी कि पढ़ना क्या है, ठीक है? पर वो जरूरी है. That is important. So see, I want to inhibit the family. The name of the family is RAAS family. Why I want to inhibit? Because of the overactivity of this family, the person is having hypertension. I'm a doctor. I want to treat hypertension in my patient. So this system is overactive. I want to inhibit it so that the BP become normal. At what level I can inhibit it? Tell me the three levels. Tell me the three levels. Inhibit the first enzyme, renin inhibitors. Inhibit the second enzyme, ACE inhibitors. Don't inhibit any of the enzyme. Inhibit the receptors. Block the receptors of the angiotensin 2. Ultimately, right? 100 सुनार की 1 लोहार की. सीधे आप रिसेप्टर को ही ब्लॉक कर दो. अब ब्लड में एंजियोटेंसिन 1 है 2 है फर्क ही नहीं पड़ता. रिसेप्टर ब्लॉक्ड है तो कोई भी आके रिसेप्टर पे एक्ट नहीं कर सकता, ना 1 ना 2. ऑल्दो 1 इनएक्टिव है लेकिन थोड़ा बहुत एक्टिव वो भी होता है, वो भी जाके रिसेप्टर्स पे एक्ट करता है. You got my point? So the best drugs are ARBs. The best are the ARBs. Say yes? Yes. The best are the ARBs, right? So you can see the 4 type of drugs. Let me teach you the drugs. Out of the, okay, so these 3 are the drugs I'm going to teach you, right? Renin inhibitors, ACE inhibitors, and ARBs. But what is their sequence of teaching? First, I will teach you ACE inhibitors, the most important. So today I am going to teach you ACE inhibitors because in the market, the first to be launched are ACE inhibitors, the most important drugs, right? See the classification. These all are the drugs which inhibit RAAS. These are RAAS inhibitors. The first enzyme renin is inhibited. The second enzyme ACE inhibited. The third, none of the enzyme is inhibited but the receptors are blocked. So the 3 type of drugs are in front of you. Learn the classification first. The most important, you should know the classification. All ACE inhibitors have a suffix Pril, P-R-I-L. The suffix is Pril. So let me read the names for you. Captopril, Enalapril, Lisinopril, Perindopril, Ramipril, Fosinopril, Quinapril, Trandopril. Don't add Pril in your name, right? अपने नाम में Pril लगा के उसका drug का नाम मत. In exam, I have seen the students. Come on, I have seen. I checked the copies now, second prop. So students learn the suffix. Okay, the suffix is Pril, but they don't learn the prefix. So वो अपने नाम में Pril लगा देते हैं, right? So don't do it, right? Gaurav Pril, Osama Pril, Annalipsa Pril happens. So don't do like that. It's a joke, right? So just learn the prefix also. So there are 7-8 drugs you have to learn. The suffix is Pril. For MCQs, it's okay. You can identify with the suffix, the Pril. Okay. Coming on ARBs. Right? In the ARBs, the suffix is Sartan. The suffix is Sartan. See the Sartan. Sartan everywhere. So let me read the drugs. Losartan, Candesartan, Valsartan, Telmisartan, Irbesartan, Olmesartan. So the suffix is Sartan. To ease, learn the suffix, but learn the prefix also. Say it again and again. So these are the Sartans, right? For renin inhibitors, the suffix is Kiran, K-I-R-E-N, Kiran. So Alice Kiran, only one name is given, but there are many other Kirans also. So the suffix is Kiran. So what are the 3 drugs? Can you tell me the name of the 3 drugs? Anyone? Who is a renin inhibitor? Who is a ACE inhibitor? And who is a ARB? Angiotensin receptor blocker. Who are they? Renin inhibitors are Kirans. These are Kirans. ACE inhibitors are Prils. And ARBs are Sartans. I used to learn like that. But learn prefix also. I am highlighting again and again. Right? Can we go ahead? Can we go ahead? Yes? Okay. So, okay. Okay, Ujjwal. Okay, got it. So can we go ahead? Can we go ahead? Okay, we should go ahead now. So let me start the first chapter, ACE inhibitors. Now, there is a way. Many students text me, they message me, ma'am, pharma padhna kaise hai? How to study pharma? Pharma is such a volatile subject now. Today you will read, you will understand, you will remember. Tomorrow, everything evaporates from the mind. You don't remember anything. So pharma is such a volatile subject. So always I ask my students that whenever you are studying pharma, these are the constant headings. So starting with drugs, the classification, and these are the constant. All the chapters you should study in this manner and make a comparative column between all of them. So first column, ACE inhibitors, make a column and study ACE inhibitor under these headings. Then the second column will be ARB, study ARB under these headings. The third column will be Renin inhibitors. So study the Renin inhibitor under this heading. So this chapter will be over in 3 columns. Make the 3 columns on 1 page only. So in the end, whenever you are going to your exam, just read the 1 page. You just revise the 3 columns under these headings. In short, you have to write here. And the complete chapter will be revised in 5 minutes. So multiple revisions are required. But you cannot revise multiple times from big books, the textbooks, from your notes. Make tables. Tables means comparative tables. For every chapter, you should have a comparative chapter of all the drugs present in that chapter. Here in this chapter, we are having 3 drugs. So make 3 columns. Take a big paper and make 3 columns. These are constant headings. So all the drugs you must study under these constant headings. Give me a thumbs up. So what are your headings? Start with the classification. Classification we have already done of all the 3. So here there are Prils, here there are Sartans, and here there are Kirans. Mechanism of action, I taught you, but I will teach you again the flow charts. Pharmacokinetics only of the prototype drug. Don't learn the pharmacokinetics of all drugs. So here the Captopril, here the Losartan, here the Aliskiran. Only one drug. Interactions you must learn. Uses, adverse effect, try to learn the mnemonic. Otherwise you will forget in the exam. So I always give more and more mnemonics to my students. And contraindications along with the mnemonics. Right? So this is how you have to study. Shall I start the first chapter, ACE inhibitor? Start writing. Have you taken your copy, pen? You are making this table with me. Start the first chapter, ACE inhibitor, under the following headings. Start the drugs. Write the drugs. Here in short, write the drugs. Then write the mechanism of action. Everything in the sequence only I am taking. The first chapter, ACE inhibitor. The drugs are in front of you. I am not reading again. All of them are Prils. You can read. Write down in short. So Captopril, Enalapril, Lisinopril, Perindopril, Ramipril, Fosapril, Quinopril, Pterendopril. So all the Prils learn like that. That's it. Right. After the drugs, let me tell you an important point. Out of them, the Captopril is the prototype. Who's the prototype? Tell me. Who is the prototype? The Captopril is the prototype. Right. Among them, among all of them, this is Captopril, Enalapril, Lisinopril, Fosinopril, Perindopril, Ramipril. Now, all of them are prodrug. You know what is a prodrug? They are inactive drugs. You see, all of them are prodrug. All of them are, only 2 are not prodrug. The Captopril is directly active. It is not a prodrug, and Lisinopril. So Capto and Lisino. This Capto and Lisino, they are directly active. Learn these 2 exceptions. ये बहुत important है. They are directly active, and except these 2, the remaining all Pril are prodrug. So which 2 drugs are not prodrug? Can you tell me the name of the 2 drugs which are not prodrug? Which are not prodrug? So the 2 drugs are Captopril and Lisinopril. Captopril and Lisinopril. है ना? Lisino ही था ना दूसरा, Lisino. Capto and Lisino. These 2 are not prodrug. Remaining them are all prodrug. You have to learn that, right? Okay. Let me go ahead. In the introduction, nothing is important. This prodrug wala. Mechanism of action you already understand. You tell me mechanism of action. Who will tell me? Who will tell me mechanism of action? Suraj, Ikwira, Gaurav, Priyanshi. Who will tell me? Yes, Sadaf, Padmavati. ACE inhibitors. ACE inhibitors are the drugs which will inhibit ACE enzyme. So once the ACE is inhibited, angiotensin 1 will not convert into angiotensin 2. So angiotensin 2 will not form. It will not form. It will not act on the 6 organs. It will not act on the 6 organs, so blood pressure will not rise. Ultimately, it will fall. This is how they act. So write in the form of the flow chart. You all are right. Yes. So ACE convert angiotensin 1 to 2. Normally, we know that. So ACE inhibitors inhibit the ACE enzyme. So angiotensin 2 is not formed. 1 is not converted to 2. 2 is not formed. It is not acting on the organs. So blood pressure will not rise. It will fall. This is how you have to write in your exam. Come on. Give me a thumbs up. But there is a problem. There is a problem. What is the problem? ACE was having double action. ACE enzyme was having double action. The first action of ACE was to convert angiotensin 1 to 2. That is occurring in the blood, right? And the second action of ACE was in the lung. It converted bradykinin and substance P to an active product. Both the things was caused by ACE, right? Now you are giving a drug which is ACE inhibitor. So ACE is inhibited in the blood also, in the lung also. Everywhere ACE is inhibited. So you want this function to be suppressed. You don't want angiotensin 1 to 2 to be converted into 2. You want this. You want to treat your patient, the hypertension. But this function is also inhibited. You don't want to inhibit this function, but unnecessarily it is inhibited. Now, bradykinin will not convert into inactive product. Bradykinin will remain as bradykinin only. And it will cause cough, yes, swelling, angioedema, itching. So these are the side effects of ACE inhibitors. Give me a thumbs up. Every drug has a side effects. So that is the side effects. You got it? Say yes. So ACE enzyme have double action. The second action is to convert bradykinin to inactive products. So whenever you are giving ACE inhibitors, it is inhibiting the ACE enzyme everywhere. It is inhibiting the ACE enzyme everywhere in the lung, in the blood. So bradykinin is not converted to inactive product. Bradykinin will remain as bradykinin only. So bradykinin and substance P will increase. Bradykinin is kinin. One of the kinin is bradykinin, and it causes cough and angioedema. These are the side effects. You got it? These are the side effects. So that you must understand. We are done with the introduction. In the introduction, learn the prodrug wala cheez. All of them are prodrug except 2, Captopril and lisinopril, which are not prodrugs. In the mechanism of action, draw the flow chart, draw the diagram, and understand what it is. But there is a problem in mechanism of action, the bradykinin and substance P wala problem that you should mention. Coming on pharmacokinetics. Pharmacokinetics, I will teach you only of one drug, Captopril. Don't learn the pharmacokinetics. No, pharmacokinetics is pure rectification. Rectification. You know, rat lo usko. You don't have to understand anything. Learn, it is orally, given orally. Learn the half-life, learn the bioavailability, but it's not important. You know, pharmacokinetics, you learn only of selected drugs. If you try to learn pharmacokinetics of complete pharmacology, you will become mad, right? So that is pharmacokinetics. Interactions, I will tell you later on. Coming on the uses. I'm having a mnemonic for you. What are the uses? One use you already know, hypertension. You are giving ACE inhibitors to treat hypertension. That is one of the use. But there are 6 uses. 1, 2, 3, 4, 5, 6. So I'm having a mnemonic for you. The mnemonic is in front of you. Home care makes patient definitely strong. Home care makes patient definitely strong. This is the mnemonic. Home ka H stands for hypertension. It is useful in hypertension. Care ka C stands for congestive heart failure. They are useful in congestive heart failure also. Makes ka M is for MI. They are useful in MI also. The patient who have heart attack, the MI, myocardial infarction, they are useful in them also. Right? Patient ka P stands for prophylaxis of MI. MI may be though. Just suppose there is a patient in my clinic who is already having an attack of MI. I will ask the patient to take ACE inhibitor daily, so that second attack aane ke chances come. Right? And there is a patient in my clinic who don't have MI till now, but the patient is obese, patient is having less physical activity, patient is a smoker. So I'm saying that you are having high risk of having MI. So for a prophylaxis, you should take ACE inhibitor. So I will give ACE inhibitor to the MI patient to decrease the risk of the next attack, next episode, and I can give it as a prophylaxis to high risk patients. Right? Definitely, D stands for diabetic nephropathy. You know, diabetes is a disease which causes 3 complications. Nephropathy, the kidneys are damaged, retinopathy, the eye is damaged, and the neuropathy, the nerves are damaged. These are the 3 complications of diabetes, the long run diabetes. So diabetic nephropathy is delayed. So diabetic patients should be given ACE inhibitors so that in them diabetic nephropathy will not happen in future, or that can be delayed. Give me a thumbs up, right? And strong ka S stands for scleroderma. In scleroderma crisis, patients have severe hypertension, that can be given. Can you help me? Can you help me with the mnemonic? Anyone? Priyanshi, Analipsa? What is the mnemonic? Home care makes patient definitely strong. Can you say it again? Say it again. Home care makes patient definitely strong. Okay, try the full form now. Try the full form. Try the full form. H stands for hypertension. C stands for congestive heart failure. M stands for MI, myocardial infarction. P stands for prophylaxis of MI. MI भी है और MI का prophylaxis भी है भाई, है ना? D stands for diabetes. Diabetes में only nephropathy, not neuropathy, not retinopathy. It will prevent only nephropathy. Out of the 3 complications, 1 can be prevented. And scleroderma. S stands for scleroderma crisis. Scleroderma crisis. Everyone give me a thumbs up. Osama, Gaurav, Vardhan, Ikvira, Sadav, Anilipsa, give me a thumbs up first. You got the full form? So these are the 6 uses. The 6 uses of ACE inhibitor. 6 uses. You can, if you are a second prof student now, you should describe them, write 2-3 lines on each of them, so you can fill 2-3 pages on that. If you are a competitive exam aspirant, learn the full form only. That's sufficient. Don't go in detail. So learn 2-3 lines. Hypertension में it is one of the first line drug. The best drug to be given a hypertension patient. Acting on the sixth organ, it decreases blood pressure. We know how, right? CHF, congestive heart failure, it decreases preload, afterload. That's why useful. MI में it reduces the chances of mortality the second attack. Prophylaxis of MI में भी ये देना चाहिए. Diabetic nephropathy में all the nephropathic patients should receive this unless contraindicated. And scleroderma crisis में भी इसको देना चाहिए. So these are the 6 uses. You got it. You got it, right? You got it. In malignant hypertension, Gaurav, malignant hypertension is an emergency. So in malignant hypertension, we don't go with oral drugs like ACE inhibitor. We directly give IV drugs. So we will give the IV drugs. So I will teach you the emergency hypertension, malignant hypertension separately in antihypertensive drug. But this is not drug of choice for malignant hypertension. This is drug of choice for stage 1, stage 2 hypertension, not for malignant. You got my point? Yes. So can we move ahead? We are done with uses. Coming on adverse effect. The mnemonic of uses is home care makes patient definitely strong. This is the mnemonic. Let me tell you a mnemonic for adverse effect. What is the mnemonic of adverse effect? The mnemonic is Captopril. The mnemonic is Captopril. Can you see the mnemonic? Captopril. So E stands for cough. You tell me the reason for cough. Can you tell me? Because of increased kinin, bradykinin and substance B. Because of that, the cough is there. A stands for angiotensin edema. The same reason. Increased kinin and increased substance B. Right? So C, A और H. यहाँ का I जो है, that stands. So same reason. Increased kinin and increased substance B. Right? So these are the 2-3 side effects because of bradykinin and substance B. ठीक है? So C for cough, A for angiotensin edema, P for proteinuria. There are 2 P. One is proteinuria. The patient have increased protein in the urine. And second P is more important, potassium is increased. Can you tell me why the potassium is increased? Okay, I will tell you. Let me tell you the full form. Another P is potassium is increased. Potassium, hyperkalemia you can say. Potassium, it is very dangerous. Patient can have arrhythmia because of hyperkalemia and patient can die. You got my point? T के लिए 2 चीजें हैं, but the important is teratogenic. Never give ACE inhibitor to pregnant female. Never. Right? Never give. Because what happened now? In a pregnant lady, she is having a fetus in the uterus. So this is the placenta and this is the fetus in the uterus. If you are giving ACE inhibitor to this lady, if you are giving ACE inhibitor, any of the ACE inhibitor, any of the Pril to this lady, what actually it will do? It will cause vasodilatation. You know, they will cause vasodilatation. Because the angiotensin 2 is causing vasoconstriction. They are opposing angiotensin 2 to cause the vasoconstriction. So basically they are doing vasodilatation, the opposite of angiotensin 2. Angiotensin 2 vasoconstriction करता है, बताया था, right? So they will cause vasodilatation of the placenta also. Because of the vasodilatation of the placenta, the blood flow in the fetus will be compromised, and fetus will not get good blood. The flow will be compromised, and fetal, the many things will happen. The congenital morbidities will happen. So it is a teratogenic drug. Don't give it in pregnancy. T stands for taste disturbance as well as teratogenic. O में कुछ नहीं है. Others में fatigue, headache. R is renal impairment, and L is low BP. Actually, you will say, ma'am, low BP तो करना है ना, but कभी-कभी कुछ ज़्यादा ही low BP हो जाएगा. Imagine a patient is coming to me with hypertension. Currently, the blood pressure of the patient is 140/100. So I started the patient. I asked the patient to take the ACE inhibitors. Take ACE inhibitors, your BP will be low and you will be normal. But if I start with the full dose now, suddenly drop in BP will be there, and 140/100 will become 90/70. I do not want this. I want 120/80. Right? So this is first dose hypotension. So don't start with full dose. Actually, you should start with half dose and gradually increase the dose because of avoiding first dose hypotension. First dose hypotension is very common. और BP low हो गया तो tablet लेते से patient को चक्कर आ जाएगा because BP is low. You do not want that. You do not want high BP. You do not want low BP. You want normal BP. So start with low dose. Gradually increase the dose. You got my point? Give me a thumbs up. Yes, Gaurav. Yes. So that is low BP. So what are the side effects? The side effect is Captopril. Captopril. Right? Can you try? Again, what is the side effect? Captopril. Pril. Can you try the full form? L is low BP. Low BP is the most common side effect. If you give full dose at the beginning, don't give full dose at the beginning. Start with half dose. Right? C for cough. Yes. And A for angioedema. And इसी से मुझे I से H भी याद आ जाता है because these 3 side effects are due to bradykinin and substance P. ये 3 मैं together ले लेती हूँ. Right? P 2 हैं. There are 2 P. The first P is proteinuria. protein in the urine, and second P is increased potassium. That is hyperkalemia. I will explain you why it is. It is very dangerous. It can cause arrhythmia. Right? अब कौन-कौन बच गया? Who is left? So T for teratogenic. Don't give it in pregnancy. Teratogenic and taste disturbance. O कुछ नहीं है. Others है. Others में fatigue वटिक ठीक है. ठीक है. O is nothing actually. To make the full form, we are adjusting O. O is no side effect. And R is renal impairment. Renal impairment. ठीक है. So these are the side effects you must learn. You must learn. ठीक है. Now hypotension तो ठीक है, कफ भी ठीक है, you got the reason for the cough, excessive bradykinin and substance P, this is the cough. Angioedema में भी the same reason, bradykinin is there, patient have swelling, angioedema especially of the lips, you got it. Yeah, I want to explain you the reason for this. Increased potassium, increased kalemia, hyperkalemia. Can you see this diagram? Can you see this diagram? You tell me, normally angiotensin II is acting on the sixth organ, which is the most important among the six I told you. Anilipsa, Sadaf, which is the most important? The most important is the adrenal cortex. From the adrenal cortex, aldosterone is coming out. Aldosterone. Right. What aldosterone does normally? Aldosterone acts on the kidney. It acts on the collecting tubule of the kidney. And what does it do? It causes sodium water. It causes sodium absorption and potassium excretion. It causes sodium absorption from the blood. And it causes potassium, means sodium retention in the blood and potassium excretion. So basically aldosterone causes potassium excretion. The potassium is excreted in the blood. Sodium absorb karta hai. Sodium water is absorbed. What does aldosterone do? Sodium water absorption. But what to the potassium? Potassium is excreted. In exchange of sodium, the potassium is excreted. But now you are giving ACE inhibitor. Give ACE inhibitor. If you are giving ACE inhibitor, angiotensin 1 will not convert into 2. 2 will not form. So opposite will happen at the aldosterone. So instead of potassium excretion, potassium will be retained. Potassium will be retained. That causes hyperkalemia. Very few students understand the reason for hyperkalemia. This is the reason. First, you should think normally. And in ACE inhibitor, opposite is happening. Because angiotensin II is not formed. So that is the hyperkalemia because aldosterone nahi aa raha. So no retention of potassium. So increased retention of potassium causing hyperkalemia. Give me a thumbs up. You got it? Yeah, renal failure में Captopril का R क्या है? Captopril का R है renal failure. Actually in renal failure you must understand renal artery stenosis. Renal failure में nephropathy में तो दे रहे हो तुम. In diabetic nephropathy you are giving, but in renal bilateral renal artery stenosis don't give it. What do you mean by bilateral renal artery stenosis? Renal artery stenosis क्या होता है? Bilateral renal artery. Can you see this is aorta? Let me draw. It is difficult, but I will try. From the aorta, these are the renal arteries coming out. The two renal arteries. Right, and they are supplying the kidneys, the right kidney and the left kidney. There is a disease known as RAAS, bilateral renal artery stenosis. Bilaterally, renal artery stenosed. So this renal artery is also stenosed, this is also stenosed because I am talking about bilateral renal artery stenosed. Now in this condition, you can't afford giving ACE inhibitor. If you are giving ACE inhibitor, what does the ACE inhibitor do? What does the ACE inhibitor do on the blood vessels? On the blood vessels, ACE inhibitor causes vasodilation. Say yes, it is causing vasodilation. So both of them will be vasodilated. So because of the vasodilation, the blood flow will be reduced. Like in placenta, it is reduced and patient can't survive. So don't give ACE inhibitor in bilateral RAAS. Please learn that. In bilateral RAAS, don't give that. Right? Rest you can understand. So the side effects are Captopril. The last is the contraindication. The contraindication is PARC. P-A-R-K, PARC. So P for pregnancy, A for allergy, R for renal artery stenosis bilateral, and K for potassium, hyperkalemia. I am done. So uses is home care makes patient definitely strong. Adverse effects is Captopril. Try to say the full form. And contraindication is PARC. That's it. If you know this now, all MCQs are in your hand. If you know the full form, give me a thumbs up. Come on, everyone. Apart from which you know the mechanism of action, introduction, side effects, everything. Give me a thumbs up. Come on, I'm waiting. So polls का भी time नहीं है. I have to end the session. I'm a little bit hurry. So I'm sorry, I'm unable to do the polls right now, but I can share the PDF with you. But I can guarantee you can solve all the questions, right? Still, if you have any doubt, you can connect me on my contact number. My contact number is 9833032948. So connect me on WhatsApp or Telegram. Tell me your college name, university, exam dates. I will help you with the schedule. And if you have any doubt related to this topic or any topic, you can text me. You can text me the topic of your choice, which you find difficult in patho, pharma, microbiology, PSM, medicine, right? So I will try to schedule them. Thank you very much. Please share the links with all your friends, colleagues, everyone. If you like the lecture, don't forget to click on the like button before leaving and share the link with everyone. Press the bell icon for the further notification and subscribe our YouTube channel. Thank you. See you. Bye-bye. Study hard. All the best for your exam. I'm ending the session.